In the interest of active consent seeking, we will be removing all AI note-taking assistants from joining the call. To save bandwidth on the call, we would request you to please turn off your camera and keep yourself in mute when you're not speaking. You can speak or ask questions in Hindi or English based on your comfort. Please also use the chat box to leave any comments or questions that you may have. We will get to the Q&A session towards the end of the presentation, but you can keep adding your questions in the meanwhile as well. And it would be great if you could also introduce yourself and your organization when you're putting the questions so that we know what context you're coming from. I will briefly share what CoreNet or the COVID Research Network is. So we came together as a community in May last year at the back of the COVID-19 pandemic with the aim of building a community of practice to foster exchange and collaboration among research organizations, gathering information on issues relevant to the COVID-19 pandemic in India. And through the last year, we've grown quite a bit in number. There are 60 plus member organizations working in 23 geographies across India. We have a vibrant workspace on Slack with over 200 members and a web platform with over 80 research projects from our members. We've also conducted 19 coffee hour sessions and 3 ethics dialogues over the past year. We are now coming together for the CoreNet Conference 2021 that seeks to bring together the community and other stakeholders to discuss learnings and experiences from the past year and for future directions. I'll quickly get into the agenda for today's session. If you could go to the next slide. Yes, thank you. So right now we're in the introduction, after which I will hand it over to the team from Center for Catalyzing Change. And after that, we will get into the questions and discussions for the last 30 minutes. I will also like to introduce the speakers now. Dr. Shiney Chakraborty is an economist and has been working in the area of women and development for the past few years, focusing especially on issues related to women's work. Dr. Shiney's core research interests have been in areas related to women's economic empowerment by enabling access to labor markets, engendering macroeconomic policies to introduce a gender lens, and analyzing public policies using the same. She regularly publishes articles in peer-reviewed journals, chapters in books, and opinion pieces in leading newspapers and magazines. Dr. Shiney has completed her PhD in economics from Jawaharlal Nehru University. Dr. Anamika Priyadarshini is currently working as the lead research at the Center for Catalyzing Change's Sakshama initiative. She has worked with national and international organizations, academic institutions as an academic and development professional. She has led several research projects as primary or co-primary investigator supported by nationally and globally known institutions like Indian Council for Social Science Research, World Bank, Government of Karnataka, Packard Foundation, and the BMGF. Dr. Anamika has also published several research articles in reputed journals like Brill and Economic and Political Weekly. She is a recipient of some prestigious international awards, including Margaret McNamara Foundation Fellowship, Ford Foundation Fellowship, and State University of New York's Doctoral and College Fellowship. She has also taught undergraduate and master's courses at SUNY and Central University of South Bihar. Dr. Anamika completed a PhD in Global Gender Studies from State University of New York at Buffalo. That's it from my end, and we are really excited to have both of you with us today. Over to you, Anamika and Shiney.
Thank you, Ayushi. As Ayushi has already briefed you, we are here with our study that discusses evolving impact of COVID on gender norms, especially how it impacted women's personal, public, and political lives during the COVID crisis in Bihar. In this presentation also, we discussed about it, that how we are still dealing with COVID crisis. But this study reflects upon last year's experience when COVID's impact on deepening divide seemed almost inevitable. And now we have enough evidence that substantiate that assumption. For instance, the recent Global Gender Gap report of World Economic Forum shows that we have slipped 28 places and now we hold 148th position for our gender gap in the world. So it is very clear that crisis often deepens divide, and its impact is usually more severe in marginalized geopolitical or socio-political or socio-economic regions. And we are here talking about Bihar today, the state which is known for both its critical development, overall development indicator, and also for its critical gender development indicator. But what is very interesting about Bihar is that the state is also known for its women-centric policy. In 2007, Bihar became the first state to reserve 50% seats for women in local governing bodies like panchayat. And therefore, right now, we have over 50% members of these bodies who are women, and many of them are serving for the second time or even for the third time. And many of them have also won from the unreserved seats. So that is something we will talk after the presentation. Do we still want to call them proxy representative because they are winning from unreserved seats? They are becoming for the second or third time as well. And we at C3 have been working with these representatives for over a decade. And during the COVID pandemic, we were hearing a lot of stories from them. They were like they became our eyes and ears of the ground realities of Bihar. And we were hearing stories of how domestic violence is increasing, how child marriage is increasing. But at the same time, women leaders were also emerging, be it frontline worker, be it panchayat leaders. So there was a complex kind of paradoxical impact of COVID that we were seeing. So we really wanted to understand, and therefore we thought of conducting this study, which kind of intends to understand how the interplay of COVID crisis and rural Bihar's social norm impacted the space for women panchayat leaders in the society and politics of rural Bihar. So this study attempts to record elected women representatives' perception about how their role as leader in panchayat or the rural local governing bodies are shaping the dynamics of local self-governance and also transforming lives of these elected women representatives, especially in the context of COVID, because COVID created additional responsibility, created kind of a lot of opportunities for them to emerge as leaders. And we have divided our study in three broad domains. In the first domain, we try to capture elected women representatives' perception about impact of COVID on the family and intimate lives of women in their constituencies. For instance, here we focused on domestic violence, women's help-seeking behavior, or existing support system or mechanism, whatever is available for the survivors. Then in the second domain, we try to understand the economic implications of COVID on the lives of elected women representatives and more important, also the people on their constituency, like how COVID overall impacted the economic life of people in their community. And we also try to understand burden of unpaid domestic work on women, especially in the context of COVID. Finally, in the third domain, we try to assess how the interplay of COVID induced responsibilities and existing socio-cultural norms impacted these panchayat leaders' personal development as community leaders of rural Bihar.
So in this study, broadly, we considered those elected women representatives who have participated in our mentoring and capacity building programming for women panchayat members across 10 districts of Bihar. Telephonic mixed method survey was conducted during the months of October and November 2020. We have used emerge tool on gender and COVID on gender and COVID questions in terms for tool development. And in our questionnaire, certain questions were of multiple choice type. The total sample size for the quantitative survey was 1,338, and for qualitative study, 31 EWOs participated in the in-depth interviews. Out of these 1,338 EWOs, we also conducted a pilot survey with 130 EWOs across the 10 districts. As Anamika has already mentioned that during the survey, information was collected from the EWOs under different sub-themes like their demographic profile, impact of the pandemic on their paid and unpaid work in the domains of their family and intimate lives, and how their leadership role have changed during this pandemic. And over the next slides, me and Anamika will try to explain all of these. And the 10 districts we have plotted in the right-hand side table also, as you can see. In terms of the demographic profile of the respondents, most of the respondents for the survey belong to the age group of 19 to 80 years, where 75% of the EWOs belong to the age group of 35 years and above, whereas 25% belong to the younger age group. Almost all of them were married. 90% was Hindu, while only 10% was Muslim. Educational profile of these elected women representative echoes the poor female literacy rate among women panchayat leaders in Bihar. Most of these elected women representatives, that is near about 87% of them were elected for the first time as ward members. And in terms of users of mobile phone, you can see that the 63% of them they have mobile phones and they use phones, but among this, only 24% of them were the smartphones. So in terms of using social media platform, WhatsApp was more popular compared to Facebook and other things. In terms of the impact of the COVID-19 on the elected women representatives' paid work, we can see that the study observes that majority of them, like you can see from the left-hand side graph, 79% of them only worked as elected women representatives only and were not engaged in any other paid employment. Those who were involved in any other paid work, apart from their role as panchayat leader, 61% of them stated that they were able to continue their work, whereas 81% of these EWOs, they received either full or partial wages or worked as usual, but did not receive any pay as usual. So among this 81%, only I can say that only 28% they received full wages. So others, they have not received full wages while they used to work. In terms of their unpaid work, we already know that the COVID-19 crisis has made starkly visible the fact that there has been a significant increase in terms of unpaid household chores and care work. Well, in this study, we also found that, yeah, it has been increased for women a lot, and 82% of the women respondents, they reported that they have to spend a considerable time behind the children in helping them with school work. And definitely childcare burden has increased significantly for them during the last 6 months when we did the survey. And 78% of them, they also stated that there has been an increase in inside household domestic chores like cooking and cleaning, while 34% of the women respondents, they highlighted the additional burden of outside household chores like fetching water, collecting firewood, and over the last 6 months. So in terms of the, we also try to see what is happening in terms of their unpaid chores across the different consumption class. And we observed that more women from the bottom consumption class, they reported that there was no increase in unpaid work compared to women of the other consumption class. And this has a implications like women from the poor consumption class, they were so used to in terms of doing unpaid chores that they were not separately acknowledging it as an additional work, particularly during the time of COVID crisis.
So this is something like unpaid work and some other issues which are on these aspects. We got more insight during our in-depth interview, and it came even in quantitative survey, a quantitative part of the study, that those women who are relatively younger and those who are part of a nuclear family, they experience the workload burden more in comparison to those women who are relatively older or who are living in extended family. So it was very clear some of the younger women were like, workload has increased, and at the same time panchayat work has increased, everybody has returned home, so all the time we are cooking, but at the same time we have to go and do panchayat work, so they were really tired and exhausted. But then there were some women who were relatively older, and they also said, yes, work burden has increased, but at the same time, they probably share that now I don't do anything at home. Since I have become the work Pratinidhi, I spend a lot of time in panchayat work. And now we have daughters or daughters-in-law who does household work. So there was a clear-cut internalization of domestic gender division of labor, and domestic work was definitely not recognized or not valued. So this was something, the more valued panchayat work was considered more recognized, more appreciable. So women were trying to associate themselves more with those type of work. And they were proudly saying that we don't need to do work at home because younger women are doing this work. And the deep internalization of gender division was clear because we are dropping out. The schools were closed, so they were not going to school, so they were most of the time they were helping at home. When we asked, do you also receive any help from son? Some of them actually got very annoyed, very irritated. Actually, one representative actually said, listen, madam, my son is studying. He's highly educated. He will get a job. Why should he learn to do household chores? So that kind of unsafe, somewhat aggressive response we got when we asked questions related to expecting men sharing the household burden. Okay, so there was a clear-cut difference between IDI participants' response and survey participants' response on the question of unpaid domestic work. Like in survey participants, I think about 39% of them said that they receive support from their husband in household chores, and 37% said that they receive support from their female relatives like daughters-in-law, or mother-in-law in household chores. But in in-depth interview, as I shared in the last slide, when we asked, do they receive support from husband or son, they were actually irritated and annoyed. But at the same time, there were some women who were finding this question a bit uncomfortable. And they were actually hesitant in sharing that, yes, it should happen. Ideally, husbands or sons should be supporting at home, but they did not receive any support from male member from their family. Whereas few of them said that, yes, they do receive support from husbands and sons. But when we asked, because, in-depth interview, you have scope to probe, you have scope to ask more questions. So when we asked, so what kind of support, what exactly they do, you will be surprised to hear that almost, I don't remember anybody could articulate what exactly what was the nature of support they received from male members of their family. So it was, we have written it in our paper also. So the study reflects that, of course, in course of development, things change and gender relations are also undergoing some changes. And that is also altering the idea of ideal family, the notion of ideal family. So maybe for some elected women representatives who are getting more exposure attending gender sensitization training and workshops. So they are understanding that in the ideal family, man and wife both should work, husband and wife both should work at home. And therefore, they were kind of hesitant in sharing that they do not receive that kind of support at home. So the question of receiving support from husband in household chores was something that made our participants very uncomfortable. The question of domestic violence, initial response of almost all 31 participants was that it doesn't happen. Then with further probing, it was like, okay, it happens, but not in my ward, not in my constituency, because girls are educated, because people are civilized, people are educated. So these things do not happen in our ward. But with like more probing, people started to say, yes, some small tips have happened in my ward as well. But later, can we go to next slide, please? But later, I think 23 out of 21 participants said that yes, it has happened in their constituency as well. What was very interesting is that there was clear tendency to justify domestic violence. Almost all of them said that it is happening because hunger has increased, because people are losing job, men are losing job, they have returned, they have nothing to eat, they have no money, so they're consuming alcohol and they're beating their wives under the influence of alcohol. So it was very clear that justification was the crisis. It was not that man should not be beating his wife, or there should not be domestic violence, or it is a criminal practice. There was no discussion on that in that line, that the point was that it is happening because there is a crisis situation. What was another interesting finding of this study was that there was a clear tendency to discourage survivors of domestic violence from approaching police, because this was considered internal matter of the community and the society or the family. And as I would read that this participant, and this is not one participant, many participants said that they would go to the family where the conflict is happening, where the domestic violence is happening, and they would try to explain them that if you fight like this, the police will come and then take money, then you would be jailed, and whatever money you should be spending on your children's future, you will be spending on court and police. So you better don't resolve your issue within them yourself. So for both the perpetrator and the survivor, this was their approach to deal with domestic violence. We can understand very well that why reporting is so low. In the previous slide also, we discussed about how they are trying to address or approach or intervene in domestic violence issues. But it was very clear that participants thought that it is a personal issue, and therefore they should not be intruding in somebody else's private matter. So most of them were like not very comfortable in interfering in such issues. They intervened only when things were out of control, or a situation of the survivor was really bad. And the usual response was same as I shared in the last slide, that if you do this, police will come, they will take money and you will be jailed and blah, blah, blah. Now I will just read the last point, and this is one Brahmin participant's response, a privileged caste Brahmin participant's response. But we heard this quite frequently, that this doesn't happen in Brahmin families or privileged caste family. This happens in underprivileged Dalit families. So this woman is saying that, no, nothing happens like this in my ward, which means domestic violence. Most of the people here are Brahmin, and the sanskar, which is culture, of Brahmin is something different. It is not small caste. Brahmin family give good sanskar, and their sons and daughters usually live outside. So in those families, nothing amiss happens. No disputes. Nobody drinks in those families. Normally disputes happen in the families where people drink. It happens in Dusad Chamar families. Dusad Chamar is the name of two Dalit communities. Many times I have been to Mukhya, and this is how they are responding to domestic violence. Many times I have been to Mukhya and Sarpanch to resolve such disputes and make them understand. When we ask them that has situation ever been out, did you hear about anything very severe? So the response is no, it didn't happen. It cannot happen because they have to, if they are at mistake, they will have to face us. I give them mild threatening, like I will call police or I will report to police, and that way they try to resolve. So very clearly the caste authority was there, and the understanding that it doesn't happen in privileged caste. And alcohol was clearly, can we go to next slide, please? Alcohol was clearly being, referred as the prime reason behind domestic violence. So clearly there was a deep internalization of patriarchal gender norms. Even the criminalized gender norms were recognized as socially accepted. And because they were not able to recognize domestic violence or even child marriage as crimes, they were not prepared to, prepare themselves for promoting health-seeking behavior. So most of them were not aware about helpline or Mahila police or any other mechanism that would help the survivors. And as I shared earlier, 23 out of 31 had acknowledged that it happens even in their constituency. And as I already shared, I think most of the points I have already shared, that it is the general perception is it happens in underprivileged communities and underprivileged castes. So it doesn't happen in privileged, educated castes where people do not drink. And finally, the common tendency is to discourage such incidences, and that should be resolved within the family and the community, and people should not be approaching police.
So their role as a panchayat leader. So in this study, we tried to portray their role played by the role played by these EWOs during the pandemic, beyond the pandemic, and how they are creating and spreading awareness in their community and rebuilding the life post-pandemic period. So before the pandemic, as you can see from the left-hand side figure, their priority areas were social services, which includes old age pension, widow pension, Indira Awas Yojana, etc., and welfare of families, road and other infrastructure issues, access to drinking water, sanitation, garbage management, and construction of drainage, childcare assistance, and Anganwadi services for children. Whereas in the right-hand side figure, you can see in the last 3 months under the pandemic, concerns around migrants or the migration and food security received the highest attention in their COVID containment work, in addition to the issues that were important during the pre-pandemic period. Their role as a panchayat leader and like what are the changes that we have observed since the COVID-19 pandemic and external lockdown have affected the lives and livelihood in different other ways. Some immediate interventions were required to rebuild lives. And after the pandemic, to rebuild lives after the pandemic, and we have asked these EWOs that what were their major concern areas in rebuilding lives. They shared that their top priority would be to improve education and schools, and among them, 48% identified the need to improve health and nutrition services in their panchayat and other districts.
Well, talking about their main responsibilities during the COVID crisis, so we at 333, we have been working with this panchayat leaders I have already shared, and we are basically the kind of work that we do with them is to try to create a kind of network of frontline workers and panchayat leaders, and these networks are trying to facilitate community women to access healthcare services, especially reproductive and maternal healthcare services. So during the pandemic, a lot of expecting women were approaching our participants to access antenatal care or access hospital for institutional delivery. So they needed transportation facilities. And I think almost all of them said that they had to arrange transportation with great difficulty for women in their constituency. Then migrant issue. Interestingly, Bihar is one of the second largest migrant center country in the world. It is known as the kind of labor supplier state of the country. But still, issue of migration had never been a priority for panchayat leaders in Bihar, as Shiney has already shared in last slide. But during the pandemic, migrants issue became very important, and many of the participants were engaged in arranging for quarantine for them, tracking them, preparing their list. They were also working with the block development officer and block officials to generate awareness, distribute masks, etc. And they were also preparing list of poor families who are in need of ration, and also distributing ration. Next slide, please. So these were some of the work that were commonly done by panchayat leaders.
We have already covered this slide, like their priority areas have changed. Some of the EWS, they have focused that during the pandemic, migration and other accessible services was their major concern, whereas post-pandemic, education and health are their major focus areas in rebuilding lives.
So if we talk about what are the main challenges elected women representative participants of this study felt in their leadership journey, so two very common challenges was socio-cultural norms and corruption that emerged quite frequently. Like this one particular EWR said that Anganwadi chief is wife of the Mukhya, and therefore this is kind of the power couple, and this power couple determines the dynamics of the village, and they determine the panchayat related issues, what is to be done, all the important decisions are being taken by this power couple, and they mostly exclude other panchayat members from decision-making processes. So that is there. Then the second kind of nexus that we learned is that the block officials, prominent institution or organizations of the village, and the male panchayat leaders, they also create kind of a nexus. And that nexus also try to exclude women members from the kind of the score group. So that is something that they were experiencing on a day-to-day basis. And one participant said something very interesting. I don't think it is here, but it is here in the last sentence. I think many of us would say that all of us might, as a female professional, at some point of our life, we might have said that we have to fight and work. We have to constantly prove ourselves and then work. So this panchayat leader was also saying that I have to fight and work. Then limited education and literacy, which emerged in last slide also, was recognized by participants as a very important challenge. Then digital gender divide is also a reality, especially in case of Bihar. And that was kind of increasing PWR's dependency on their husbands, and especially sons, actually. Like, for instance, they were expected to take photographs and share, and some of the apps they needed to download to do the follow-up of COVID program. But only 63% of our participants had a phone, and out of those 63%, only 24% had the smartphone. And out of those who had the smartphone, some of them did not know how to use it. So they had to depend on their sons for the uses. And for transportation, they had to depend on their husbands.
So we tried to ask them who helped them in their daily panchayat work in the past 6 months during the pandemic. And almost 80% of them shared that their husbands helped them, as Anamika has already mentioned. Their husbands are used to help them in their official work. But and only 7% of women respondents, they pointed out that nobody helped them and they alone managed their panchayat work along with their other work. You can see from the right-hand side table the types of help they usually received in their daily panchayat work. Among these women representatives, most of them, they received help from, as I already mentioned, from their family members, and 75% of these women respondents stated that they need help in maintaining documents and files, while 70% received help in understanding the financial process. So even if you can see, like 64% of them, they used to take help from their husbands for going out for the official meetings and other outreach related work. So it overall it indicates that there is a kind of dependency in terms of their in terms of their panchayat work to their nearest family members.
So when talking about common support system, many of them said that they do receive support from the block office, and husband and son was commonly referred as another support provider, especially for the transportation and uses of smartphone. And husband's role was kind of also referred that husband is trying to motivate them. But what is very interesting that some of them also said that us, I mean, use of, they were using a lot us. It's not just people came to me, people come to us. And that means that both the husband and wife. So we have heard about this term that Mukhiya Pati or Panchayat Pati or Sarpanch Pati. So that definitely is a prevalent phenomena. We cannot deny that. But that was not common. It did not emerge as a very common phenomena in our research. Many women said that, yes, I do my work independently. But at the same time, yes, these are the kind of support that they are receiving from the community, from the block, from husband and son, especially in related to panchayat work. Okay, I think we have already addressed, if you talk about version of leadership, they were like being educated was something that they were quite proud about. Being able to go to their constituency, visit their people in their constituency independently was something they were very proud about. And I'll just, for the sake of time, I'll just go to the last point. They have a very good understanding of the ground realities also, and they had clear aspiration. Many of them had clear aspirations, and they were preparing themselves for that also. For instance, one woman said that she's being asked by a lot of people in her community that she should contest, and she's saying that I don't know if I will win or not, so I want to prepare myself for next election, and I will fight election only when I feel that I'm prepared. Yeah, I'll just talk briefly about notion of leadership. People's attitude towards these women representatives has clearly changed during the COVID crisis, and they're emerging as popular leaders. Another interesting thing is that popular programs like open defecation campaigns impact was very clear in their aspirations for their community. But what is very interesting is that unlike open defecation campaign, child marriage campaign, which was started government in 2017, that has not succeeded in capturing their imagination or attention. So I would say that their idea of leadership usually reflected the complex interfaces of social norms and the normatively perceived notions of women's empowerment. And to a great extent, these notions either subscribed or manifest to conventional notions of leader or leadership, and these are not necessarily anti-patriarchal. For instance, a popular leader, a good ideal leader should not let the issue of family and community go to police, and therefore discouraging survivors of domestic violence from approaching police is a good thing. It is very clear that in the time of crisis, local governing bodies can play a very important role, and it is very important to strengthen them. They have definitely become more confident during this time, but at the same time, they also need tools and access to information and other inputs like education, financial literacy, digital access, easily accessible and affordable transportation facilities. These are kind of essential for their empowerment. At the same time, perspective building around social institutions like caste and gender and its interface with development policies, especially in the bridging gender gap, is also very important. For instance, they need to understand that violence is a crime and workforce participation is important for women, and therefore women need to also, they should not be doing all the household chores. They need some time to study. Girls' education is also important. Otherwise, it's very difficult to expect proper transformation. This is on methodology. I think it was, so the study was conducted in the month of October and November, and that was the time of election. That was the time of, we were just like out of peak time of COVID crisis. That was the time of festival also, and some district of Bihar was affected by flood. So these panchayat leaders were extremely busy. And most of the time they would say that call me at 7 p.m. or 8 p.m. And we would call at that time and they would talk. And in many cases, they said that this experience of reflecting upon their role was kind of very, very kind of, it enhanced their confidence. And they were very happy about sharing, and because nobody had ever asked them this question. So these were the kind of response. So we think Indepth Interview or tele-survey could be very effective in time of crisis because people are busy and on telephone they might be able to share more. But at the same time, there is limitation also. We couldn't get a lot of response on issues like domestic violence. We could not observe the participant. A second point is that we collected the data in two parts. In first phase, we collected demographic profile. And in second phase, we collected, we administered the survey, tele-survey. And then in third phase, we conducted in-depth interview. So that really helped us in kind of making it shorter. So on telephone, after 20, 30 minutes, people lose interest. So that is the way we try to do. So definitely mixed method approach helped us tremendously. And finally, this mixed method approach helped us in recording 1,338 participants' perspective about COVID's impact on the society and economy, and also creating scope for understanding the complex interplay of COVID crisis, social norms, and evolution of these panchayat leaders as dynamic community leaders of rural Bihar. Thank you. I will not go through acknowledgement, but yeah, we are deeply thankful to the participants, Professor Anita Raj, Bill and Melinda Gates Foundation, Packard Foundation, Shubha Lakshmi Nandi, and Model Resource Center who helped us in collecting data, and Dr. Shima who helped us in connecting qualitative data, and C3's field team.
Thank you so much, Shiney and Anamika. That was a great presentation, and it was incredible to learn about the research findings and how this really covered like the intricacies, the various intricacies from different parts of the life, both tangible and intangibles, and like give a very holistic understanding about women's participation and leadership. And I think we can move on to a question and answer session now. And I would request anyone who wants to ask a question to feel free to unmute yourself, turn on your video and ask your question, but also feel free to post your question in the chat box and we can read them out. Right, we have a question from Nandita. Nandita, would you like to unmute yourself and share your question, or would you like me to do it?
Sure. Hi, everyone. Thank you, Anamika and Shiney. Great presentation. I think my question, I sort of wrote it out because it might be easier to read and respond. But basically, I'm really struck by the fact that you said during the qualitative work, like that women were very hesitant to even, be able to articulate what it is that men sort of support them with at home. But when it came to like talking about support at work, like who helps you through your leadership journey and, helps you through your work, there were a lot of responses. So I was just like intrigued by that dichotomy. And I was wondering if that is because men themselves have sort of segmented their roles into what they can or, cannot sort of do, like what's acceptable to help or not help with. Or is it that some of these women could be like proxy candidates? So, like in some places we do see that there are seats that are for women. So it's women who are there, but men who run the show. So I was just wondering your thoughts based on what you've seen in your data.
Thank you so much, Nandita. And I'm so happy that you asked this question because I was about to say that do we still want to call them proxy representatives? So it's not, yes, on the question of receiving help from men in domestic chores, yes, they were hesitant. But other than that, they spoke very frankly. Even on domestic violence, they said that it happens and people be badly, some people have been really violent against their wives during the COVID crisis. And many of them said, what is very interesting, not even an IDI, even in survey, let's say about 75% participants said that it doesn't happen in our area. But then 60% said that they intervened in such matters. And maybe 30% said that it has increased in last 6 months. So there was a variation. So that gap was very clear. And when we ask questions which are socially accepted but criminalized, then it is quite normal. Even if we would have gone in person and asked such questions, we would have received similar response. Coming to the proxy representative, I am just not sure if we still want to call them proxy representatives, especially after conducting this study. Because yes, there are some women, but at the same time, if we look at the idea of women's empowerment, we really need to question it. If a woman is not able to commute in her constituency independently, she is automatically labeled as dependent women, proxy women, whatever. At that time, we really forget that what are the public transportation system, what are the constraints. And this is very gendered because I'm sure all men depend on their wives for their, they cook for them, they clean their house, look after the children, but men are not dependent. So if in public space, even for minor dependence on men, automatically puts women in the level of dependent women or unempowered women or yet to be empowered women, I think that is something we need to question. Yes, men are running show, but at the same time, I would say this is not that common anymore because Bihar is also a state where male migration is pretty common. It's very high. During the COVID crisis, we saw that. And this is like for the 15 years, they have been, they have been working as panchayat leaders, many of them serving for second or third time. I'm not saying that their idea of leadership or they're rupturing, they're not, it is not anti-patriarchal for sure, but they are rupturing patriarchy. They're changing the dynamics of rural Bihar for sure. And it is not just panchayat women, actually it's a churning. There is a churning going on actually. Frontline workers are coming out, teachers are there. A lot of women are coming out and they are being in public space. So men are also dealing with it and there is a transition going on.
I agree with you. I think talking about like this whole supported at work for women leaders can sometimes, be a double-edged sword. Like it can kind of, as you said, be misinterpreted because, there's no harm in supporting, but at the same time, you can get called proxy or whatever. Right. So thank you for your response on that. Okay, so I was traveling in one village and I was talking to frontline workers and I had interaction with PSC members and they said that these two are the best. And later they said that, let's say A is best, B is also a very good worker, but B is not empowered. She's not independent. Second day, we had interaction with both A and B and A came in a chauffeur-driven car and we were supposed to meet at 10. She came around noon and she made people wait in her community. Eventually, we learned that she comes from a very powerful family and she has a car and a driver and everybody. And we conducted meeting and her response was exactly what the PHC staff would have wanted anybody to tell. It was like kind of a, very, very flowery picture of PSC. Everything is very nice over there. The B, the another person, she was accompanied by her husband. She reached on time, helped us in doing our work. And she was excellent. And her response was kind of balanced. She was also trying to paint a good picture, but at the same time, she was also trying to give the real picture. But if you talk to PSC staff, they will immediately say that this woman's husband is dropping her to PSC or helping her to commute into her field. Now, this woman's husband is a returning migrant. He's 45. He has returned. This couple, and there is no job for them. So this couple has a plot. They are trying to manage, helping each other and managing their lives. But within the dominant narrative of empowered women, she doesn't fit. So that's just an insight.
Thank you so much, Anamika and Shiney, for sharing that. And we really learned so much, such amazing, rich stories from your research that I think offers so much for all of us to reflect on, especially considering the situation now. We just wanted to wind up by saying that we have 2 interesting plenaries. In the evening today at 4 p.m., we have a panel discussion around the impact on nutrition and food security. And at 6 p.m., we have another session around the impact on family planning and SRH. So maybe also connecting back to some of what Anamika and Shiney shared with us, and their colleague from C3, Aparajita, will be moderating the session. Apart from this, we have other sessions planned for Thursday and Friday next week. You'll find all of these details on the CoreNet website. And if there's anyone here who hasn't joined the community and you'd like to, please reach out to us at hello@CoreNet. That's all from us. Thanks once again so much, Anamika and Shiney. And Anamika, we hope you feel better soon. And special thank you for still doing this despite being unwell.